I am Dr. Kaniganti, and I am on the board of directors of the Grillo Center. For a number of years, I have been working with this idea that in order to empower patients, I needed to be able to provide them information. And I know that I cannot provide that within the construct of a family medicine clinic where at most I have 20 minutes. Now there are organizations across the country that do research on just that. What does it mean to make an informed medical decision? What do patients need in order to do that? And obviously it's not just information, because there's plenty of information out there. There's plenty of bad information out there. You go on the web and I have lots of patients coming back to me saying, you know, I've read this and I've read that. I get many questions that are pretty common to the general public, but perhaps many that are really salient and relevant for the Boulder population, who is very educated and who want to be able to ask physicians questions that reflect an even higher level of insight and information. Unfortunately, some of that information is pretty controversial. Medical science may not have quite arrived with a complete response, or if they have, it requires a fairly sophisticated discussion after reviewing the evidence that exists. So, can you find the evidence that you need? So what I frequently do for my patients when I have time is that I will go into the websites that I subscribe to and I say, let me email you this information. Let me talk to you for 5 minutes about what I'm finding out. Let me give you the gist. Very frequently though, the busier I get, the less time I have. And I know that there are physicians out there with a heart of gold who don't have the time to do this. We just don't. We need to get present and attend to the needs of the next patient that's there and not carry in this question to the next patient. So I was really happy to find out that there was an organization like the Grillo Center that frankly came out of the hearts of very idealistic people who were ill and did not want others to suffer as they did, without access and without help. The Grillo Center is that it both provides information completely remotely. You can email somebody and ask a question that you have, and I'll give you an example of this in just a minute. And you'll get an email response. But you can also go to the center and have somebody teach you how to access information and do it with you. Look for information. And this sort of a human contact that takes your hand and gives you the information that you seek so that you can then make a good decision about where to go next. This is beyond valuable.